The deadline for updated immunization records has passed for elementary and high school students. Incomplete records means students could face a 20-day suspension from school. Here to give us an update on that situation is Dr. Matthew Tenenbaum with the Wellington Dufferin Guelph Public Health. Hi, Dr. Tenenbaum. Nice to see you again.
Good to be here. Thank you for having me.
Okay, let's start. We're getting an updated on immunization records for students. Has there been suspensions in the region this year of students with incomplete records?
Yeah, so last week we actually hit our date where students who were still overdue were suspended from school. And the way the process works is that if you don't either get the recommended vaccines or required vaccines, and you don't submit an exemption with public health to show that you are, not going to get those vaccines, you can be suspended for up to 20 school days. And so last week we had about 830 students who were suspended. Now, the vast majority of those students are now back in school. They've either gotten their vaccines or filed their paperwork, but it does definitely generate some activity. People do get that information to us as soon as the suspension letters go out, and they are really about required vaccines for school, things like vaccines against measles, mumps, tetanus. We do want to make sure those vaccines are up to date, or we at least have a filed exemption on our end from that family.
Now, you just mentioned exemptions. What would qualify someone for an exemption?
So there's basically two kinds of exemptions. One is a medical exemption. So very rarely there are people who can't get a vaccine safely because of their own medical history. So for example, if you have a child who medically is very immunocompromised, it may not be safe for them to receive certain kinds of vaccines. In that scenario, their doctor will file a form with us that basically allows them to sign off on the fact that the medical issues prevent them from being immunized. That's one kind of exemption. The other kind, what we see more commonly, are what are known as philosophical exemptions. That's where a family has made a decision based upon their religion or deep-seated philosophical belief that their child can't be immunized, and that is also an option available to families.
Now, if someone has a child at home who has been vaccinated, but their records haven't been updated, where would they go to update those records?
So there are a number of ways the family can get records to us. They can either go to their physician and ask them to submit to us. More commonly, what we see is people sending them to us through phone, through fax. We also accept them by email. We do try to make it as easy as possible. There is always, at all times in the year, an online system you can submit records through, and we try to recommend people do it in advance of getting the notices around the time the vaccines are given. But there are a whole bunch of options people have, whether it's using that online portal, faxing, phoning, emailing. We do try and make it as easy as possible.
Now, what would happen if someone hasn't updated their record even after suspension has taken place?
So if you have a student in our area who hasn't gotten the vaccines, or we at least haven't gotten a record that they've gotten the vaccines, and they haven't gotten an exemption filed with us, that is a student who, with a lot of warning in advance, would be getting a notice that they're being suspended for school. That suspension lasts for up to 20 school days, so about 4 weeks. And really, the intention there is to make sure that they understand the seriousness of these vaccines and the diseases they prevent, and to really enable them to have a prompt to get those vaccines if they're overdue, or file the paperwork. We don't like the idea of kids being out of school, but we also want to make sure our community is protected against diseases like measles, which are making a comeback right now. And so for those students, they will have gotten a lot of notice in advance, but eventually a suspension order to their school, so they aren't able to attend school for up to 4 weeks.
Okay, well, thank you for that update. Now, we want to switch gears here a little bit. It's also World TB Week. Dr. Tenenbaum, why is it so important to have a week dedicated to tuberculosis and its impact on society?
Yes, that's a great question. So tuberculosis is probably a disease most people don't think a whole lot about. We're fortunate that being in Canada, it's not a very common disease. It is still, unfortunately, very common around the world. It's still the leading cause of death worldwide from an infectious disease. If you think about that, given the scale of the world and given all the diseases out there, including things like COVID and flu and measles, the fact that TB is still the leading cause of death really speaks to the number of people who are infected every year and who unfortunately die despite the fact that this is a curable illness. So we don't think a whole lot about it in Canada typically, but we still have TB present. We see a lot of cases in people who are particularly vulnerable because of their social circumstances or because of the part of the world in which they grew up before coming to Canada. And we want people to understand that this disease still requires our attention. It's not a disease against which we can let up the fight. Fortunately, it is a disease that with the right resources can be diagnosed and managed and cured for people, but we can't take our eye off the ball. We can't treat this as a solved problem. People do still die of TB every year around the world, including in the developed world, and that means that we need to redouble our efforts to make sure of finding those cases, linking them to treatment, and making sure their contacts are taken care of.
You just mentioned it a little bit, but last question is, what should someone do if they suspect they've been exposed to TB?
So typically, if we ever learn about an exposure to TB in public health, we take the initiative and follow up with those people. We recommend that they get assessed and get tested. There are a number of steps people ought to do if they've been exposed to TB, and it does depend on the nature of that exposure. But the key thing to know about TB is that in some people, after being exposed, you can shortly thereafter begin developing TB illness, which involves things like having a cough, fevers, weight loss, night sweats, things like that, that can be a little bit slow to develop and sometimes easy to ignore. But for a lot of people who are exposed to TB, they won't immediately feel ill. They may actually have the TB infection in them for months or years or even decades before they develop the illness. And for those people, the important thing that we recommend they do is get tested, because if you can catch that early infection, even if it hasn't caused illness yet, that's also treatable before it ever causes them problems. So we do make sure we follow up with people who we know are exposed to TB because they could be sick, or because they could be getting something in advance of them being sick that will help prevent that.
Great insight. Thank you, Dr. Tenenbaum, for your update on public health today.
Thank you very much, Ashley.